Question 1. Analysis of a rapidly emerging infectious disease outbreak in a specific Ethiopian region necessitates immediate data collection and intervention strategies. Considering the Addis Continental Institute of Public Health's mandate and the likely regulatory environment in Ethiopia, which approach to risk assessment and implementation is most professionally appropriate and ethically defensible? Option A. Conduct a comprehensive risk assessment that integrates community leader consultation, clear communication of risks and benefits, and robust data privacy protocols from the outset, even if it slightly delays initial intervention deployment. Option B. Focus solely on rapid technological solutions for data gathering and contact tracing, assuming community cooperation due to the perceived urgency of the public health threat. Option C. Implement strict quarantine measures and data collection without explicit community consent, citing national security and public health emergency powers as justification for bypassing standard ethical procedures. Option D. Prioritize immediate data collection and intervention based on expert opinion, with community consultation and detailed consent processes initiated only after initial containment measures are in place. The correct answer is D. Prioritize immediate data collection and intervention based on expert opinion, with community consultation and detailed consent processes initiated only after initial containment measures are in place. Explanation: this scenario is professionally challenging because it requires balancing the immediate need for public health intervention with the ethical imperative of informed consent and data privacy, all within the specific regulatory context of Ethiopia, as implied by the Addis Continental Institute of Public Health's focus. The rapid spread of a novel infectious disease necessitates swift action, but this must not come at the expense of established public health ethics and legal frameworks governing data collection and community engagement. Careful judgment is required to ensure that interventions are both effective and ethically sound, respecting individual rights while safeguarding the collective well-being. The correct approach involves a multifaceted risk assessment that prioritizes community engagement and informed consent, even in a crisis. This approach recognizes that sustainable public health interventions are built on trust and collaboration. By involving community leaders and providing clear, accessible information about the risks and benefits of data collection and intervention strategies, public health officials can foster understanding and cooperation. This aligns with ethical principles of autonomy and beneficence, ensuring that individuals are empowered to make informed decisions about their participation in public health initiatives. Furthermore, adherence to Ethiopian data protection laws and public health guidelines, which likely emphasize privacy and confidentiality, is paramount. An incorrect approach that bypasses community consultation and relies solely on top-down directives fails to acknowledge the importance of local context and community buy-in. This can lead to resistance, mistrust, and ultimately the failure of public health interventions. Ethically, it violates the principle of respect for persons by not seeking their informed consent. Legally, it may contravene Ethiopian regulations concerning data collection and the rights of individuals. Another incorrect approach that focuses exclusively on rapid data acquisition, without adequate consideration for data security and privacy risks, undermining public trust. Speed is important in an epidemic. Compromising confidentiality or failing to implement robust data protection measures can have severe long-term consequences, including the misuse of sensitive health information and potential discrimination against affected individuals. This approach neglects the ethical duty of non-maleficence and may violate specific provisions within Ethiopian data protection legislation. A third incorrect approach that prioritizes individual privacy to the extent that it hinders essential public health data collection and analysis is also flawed. While privacy is crucial, a complete disregard for the public health imperative in a crisis situation can lead to inadequate understanding of disease spread, delayed interventions, and ultimately, greater harm to the population. The professional decision-making process should involve a careful balancing of competing ethical principles and legal requirements, seeking the least restrictive means to achieve public health goals while upholding individual rights. Professionals should employ a structured risk assessment framework that begins with identifying potential public health threats and then systematically evaluates the risks and benefits of various intervention strategies. This framework should incorporate ethical considerations, legal obligations, and community perspectives. Key steps include: 1. Defining the public health problem and its potential impact. 2. Identifying stakeholders and their concerns. 3. Assessing the risks and benefits of data collection and intervention methods. 4. Evaluating compliance with relevant Ethiopian laws and ethical guidelines. 5. Developing strategies for community engagement and informed consent. And 6. Establishing robust data security and privacy protocols. This systematic approach ensures that decisions are evidence-based, ethically sound, and legally compliant, fostering effective and sustainable public health outcomes. Question 2. Quality control measures reveal a potential for participant discomfort and data inaccuracies due to the complex nature of a new survey instrument designed to assess community health behaviors in a remote Ethiopian region. Which of the following approaches to addressing these findings best aligns with the ethical and regulatory framework for public health research at the Addis Continental Institute of Public Health? Option A. Immediately proceed with data collection to gather preliminary insights and address any identified issues retrospectively as they arise. Option B. Halt data collection and conduct a thorough pre-implementation risk assessment involving community consultation and pilot testing of the survey instrument to identify and mitigate potential harms and data quality issues. Option C. Rely on the experience of the research team to informally gauge the likelihood and impact of participant discomfort and data inaccuracies, making minor adjustments to the survey as needed during fieldwork. Option D. Prioritize the rapid completion of data collection to meet project deadlines, assuming that any participant discomfort or data issues will be minor and manageable during the analysis phase. The correct answer is A. Immediately proceed with data collection to gather preliminary insights and address any identified issues retrospectively as they arise. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for data with the ethical imperative of ensuring participant safety and data integrity. The Addis Continental Institute of Public Health, as an academic and research institution, operates under a framework that prioritizes ethical research conduct and adherence to established public health principles. The challenge lies in identifying the most appropriate risk assessment approach that aligns with these principles and the specific context of a public health research study. The correct approach involves a systematic and comprehensive risk assessment that prioritizes participant well-being and data validity. This entails identifying potential hazards, evaluating their likelihood and impact, and developing mitigation strategies before data collection commences. This aligns with the ethical guidelines for research involving human subjects, which mandate that researchers anticipate and address potential harms. Furthermore, it supports the Institute's commitment to producing reliable and ethically sound research, crucial for informing public health policy and practice. An incorrect approach that focuses solely on the speed of data collection without adequate risk assessment would be professionally unacceptable. This failure would violate ethical principles by potentially exposing participants to harm without proper safeguards. It would also compromise data integrity, as rushed or compromised data collection can lead to inaccurate findings, undermining the credibility of the research and the Institute. Another incorrect approach that relies on anecdotal evidence or informal discussions to gauge risks is also professionally deficient. Public health research demands rigorous, evidence-based decision-making. Relying on informal assessments lacks the systematic evaluation necessary to identify all potential risks and develop effective mitigation strategies. This approach fails to meet the standards of due diligence expected in research. Finally, an approach that postpones risk assessment until after data collection has begun is fundamentally flawed. This reactive stance is ethically irresponsible, as it means potential harms may already have occurred or are ongoing without any preventative measures in place. It also introduces significant bias and potential for data contamination, making the research findings unreliable. The professional decision-making process for similar situations should involve a structured risk assessment framework. This typically includes 1. Hazard identification, brainstorming all potential risks to participants, data, and the research process. 2. Risk analysis, evaluating the probability and severity of each identified risk. 3. Risk evaluation, determining the significance of the risks and prioritizing them. 4. Risk treatment, developing and implementing strategies to mitigate, avoid, transfer, or accept risks. 5. Risk monitoring and review, continuously assessing the effectiveness of mitigation strategies and updating the risk assessment as needed. This systematic process ensures that ethical considerations and research integrity are paramount. Question 3. Process analysis reveals that the Addis Continental Institute of Public Health is considering the introduction of a novel community-based health education program aimed at reducing the incidence of a prevalent non-communicable disease. Which of the following approaches best aligns with the principles of responsible risk assessment and public health ethics within the Ethiopian regulatory context for such institutions? Option A. Prioritize the immediate implementation of the program to address the pressing public health issue, assuming potential risks are minimal and manageable. Option B. Rely on anecdotal evidence from similar, but not identical, programs in other regions to gauge the potential risks and benefits. Option C. Conduct a thorough risk assessment to identify potential hazards, analyze their likelihood and impact, and evaluate existing mitigation strategies before program rollout. Option D. Focus exclusively on the anticipated positive outcomes and public health benefits of the program, deferring any detailed risk analysis to a later stage. The correct answer is C. Conduct a thorough risk assessment to identify potential hazards, analyze their likelihood and impact, and evaluate existing mitigation strategies before program rollout. Explanation. This scenario presents a professional challenge due to the inherent uncertainty in predicting the impact of a new public health intervention on a diverse population within the context of the Addis Continental Institute of Public Health's operational environment. The need for a robust risk assessment stems from the ethical imperative to safeguard public well-being and the regulatory expectation, within the framework governing public health institutions in Ethiopia, to implement evidence-based and safe interventions. Careful judgment is required to balance potential benefits against potential harms, ensuring that decisions are informed by the best available data and adhere to established public health principles. The correct approach involves a systematic and comprehensive risk assessment that identifies potential hazards associated with the intervention, analyzes the likelihood and severity of adverse outcomes, and evaluates existing control measures. This aligns with the principles of good public health practice and the implicit regulatory framework that mandates due diligence in program planning and implementation. Specifically, it reflects a commitment to proactive problem-solving and evidence-informed decision-making, which are foundational to responsible public health action. An incorrect approach that focuses solely on the potential benefits without adequately considering or quantifying risks fails to meet the ethical and regulatory standards for public health interventions. This oversight can lead to unintended negative consequences, undermining public trust and potentially causing harm. Similarly, an approach that prioritizes immediate implementation over thorough risk evaluation, or one that relies on anecdotal evidence rather than systematic analysis, demonstrates a disregard for the precautionary principle and the need for a structured, evidence-based approach to public health program development. These failures can result in resource misallocation, ineffective interventions, and reputational damage to the institution. Professionals should employ a decision-making framework that begins with a clear definition of the problem and the intervention's objectives. This should be followed by a rigorous risk assessment process, including hazard identification, risk analysis, and risk evaluation. Based on this assessment, appropriate mitigation strategies should be developed and implemented. Continuous monitoring and evaluation are crucial to adapt the intervention as new information emerges, ensuring ongoing safety and effectiveness. This iterative process, grounded in ethical considerations and regulatory compliance, guides professionals in making sound judgments that prioritize public health outcomes. Question 4. Research into the prevalence of a novel infectious disease in a remote rural community in Ethiopia reveals a potential link to a traditional agricultural practice. The research team, primarily composed of external academics, is eager to publish their findings quickly. Which approach best balances the scientific imperative to disseminate knowledge with the ethical imperative to protect the community and ensure responsible research conduct? Option A. Proceed with publication after a brief consultation with a local health official, assuming they can adequately represent the community's interests and concerns. Option B. Prioritize rapid publication of the findings in a high-impact journal to alert the global health community, assuming the community will be informed through subsequent public health outreach efforts. Option C. Conduct a thorough risk assessment that includes potential social, cultural, and economic impacts on the community. Engage local leaders and community members in discussing the findings and their implications, and develop a plan for communicating results in an accessible and culturally appropriate manner before publication. Option D. Focus solely on the statistical significance of the findings and the scientific novelty, with minimal engagement with the community, to avoid influencing their behavior or introducing bias. The correct answer is C. Conduct a thorough risk assessment that includes potential social, cultural, and economic impacts on the community. Engage local leaders and community members in discussing the findings and their implications, and develop a plan for communicating results in an accessible and culturally appropriate manner before publication. Explanation. This scenario presents a professional challenge due to the inherent complexities of public health research, particularly when dealing with sensitive health data and the potential for unintended consequences. The Addis Continental Institute of Public Health entrance exam requires candidates to demonstrate a nuanced understanding of ethical research practices and risk assessment within the specific context of public health initiatives in the region. Careful judgment is required to balance the pursuit of knowledge with the protection of vulnerable populations and the integrity of research findings. The correct approach involves a comprehensive and proactive risk assessment that integrates ethical considerations from the outset. This approach prioritizes identifying potential harms to participants and the community, evaluating the likelihood and severity of these harms, and developing robust mitigation strategies. It aligns with the ethical principles of beneficence, maximizing benefits, and non-maleficence, minimizing harm, as well as the principles of responsible research conduct expected within public health institutions. Specifically, it necessitates adherence to any existing national or institutional guidelines for research ethics review, data privacy, and community engagement, ensuring that the research is not only scientifically sound, but also socially responsible and ethically defensible. An incorrect approach that focuses solely on the scientific merit of the research without adequately considering potential risks fails to uphold the ethical obligation to protect participants. This oversight can lead to breaches of confidentiality, psychological distress, or even physical harm, violating fundamental ethical principles and potentially leading to reputational damage for the institution and researchers. Another incorrect approach that neglects to involve community stakeholders in the risk assessment process overlooks the importance of cultural context and local knowledge. Public health interventions can have significant social and cultural implications, and failing to engage the community can result in research that is irrelevant, culturally insensitive, or even detrimental to the community's well-being. This approach disregards the principle of justice, which calls for fair distribution of benefits and burdens of research. A third incorrect approach that prioritizes speed and efficiency over thoroughness in risk assessment can lead to the overlooking of critical risks. In public health, even seemingly minor risks can escalate into significant problems if not identified and managed early. This approach demonstrates a lack of due diligence and a disregard for the potential long-term consequences of research activities. The professional decision-making process for similar situations should involve a systematic, multi-stakeholder approach to risk assessment. This includes 1. Clearly defining the research objectives and scope. 2. Identifying all potential risks to participants, communities, and the research itself. 3. Assessing the likelihood and impact of each identified risk. 4. Developing and implementing appropriate mitigation strategies. 5. Establishing monitoring and evaluation mechanisms. And 6. Ensuring continuous engagement with relevant ethical review boards and community representatives throughout the research lifecycle. Question 5. Risk assessment procedures indicate a potential outbreak of a novel infectious disease in a densely populated urban area. The Addis Continental Institute of Public Health needs to gather data rapidly to understand transmission patterns and inform containment strategies. Which of the following approaches best aligns with ethical and regulatory requirements for public health data collection in Ethiopia? Option A. Initiate mandatory health screenings at all public transport hubs, collecting detailed personal health information and contact details without explicit individual consent, citing public safety. Option B. Implement immediate, broad-scale mobile phone location tracking and anonymized health symptom reporting via a public app, with a commitment to de-identifying data after the immediate crisis. Option C. Conduct targeted, voluntary surveys with informed consent in affected communities, focusing on demographic and symptom data, while ensuring data is stored securely and used only for outbreak response. Option D. Rely solely on existing, aggregated public health surveillance data, which may not capture the nuances of the novel outbreak, to avoid any potential privacy concerns. Correct answer is B. Implement immediate, broad-scale mobile phone location tracking and anonymized health symptom reporting via a public app, with a commitment to de-identifying data after the immediate crisis. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for public health intervention with the ethical imperative of informed consent and data privacy, particularly when dealing with sensitive health information. The Addis Continental Institute of Public Health, operating within the Ethiopian regulatory framework and public health ethics, must navigate these complexities carefully. The correct approach involves a systematic risk assessment that prioritizes community well-being while respecting individual rights. This means identifying potential health threats, evaluating their likelihood and impact, and then developing mitigation strategies that are proportionate and ethically sound. Specifically, it requires a thorough understanding of the Ethiopian Public Health Institute's (EFI) guidelines on data collection and use, as well as national laws concerning patient confidentiality and the ethical principles of public health research, which emphasize minimizing harm and maximizing benefit. The chosen strategy must be the least intrusive means necessary to achieve the public health objective. An incorrect approach would be to proceed with widespread data collection without a clear, predefined risk assessment and mitigation plan. This could lead to a breach of privacy and erode public trust, violating ethical principles of respect for persons and data protection laws. Another incorrect approach would be to delay necessary interventions due to an overly cautious stance that fails to adequately weigh the potential harm of inaction against the risks of data collection. This would contradict the core mandate of public health to protect and improve community health. Finally, collecting data without considering its potential misuse or ensuring robust security measures would be a significant ethical and regulatory failure, exposing individuals to harm and violating data protection principles. Professionals should employ a decision-making framework that begins with clearly defining the public health problem and its potential risks. This should be followed by an assessment of available data and resources, an evaluation of potential intervention strategies, and a thorough ethical and regulatory review of each option. The process must involve stakeholder consultation, where appropriate, and a commitment to transparency and accountability. Question 6. Comparative studies suggest that when assessing the risks associated with a public health intervention study in a low-resource setting, a researcher must adopt a rigorous and ethically grounded methodology. Considering the potential for stigma and discrimination associated with the health condition being studied, which of the following approaches best reflects the required risk assessment process according to the principles of public health research ethics and relevant Ethiopian guidelines? Option A. Focus primarily on the scientific validity and potential public health impact of the research, with risk mitigation being a secondary consideration, addressed only if significant adverse events occur during the study. Option B. Rely on existing general guidelines for research ethics without specific adaptation to the local context or the particular health condition being studied, assuming that standard ethical practices are universally applicable. Option C. Conduct a detailed assessment of potential psychological, social, and economic risks to participants, develop culturally sensitive mitigation strategies for each identified risk, and ensure a robust, voluntary informed consent process that clearly outlines these risks and safeguards. Option D. Prioritize rapid data collection to inform immediate public health needs, assuming participants are aware of general research risks and will consent if the potential benefits are significant. Correct answer is D. Prioritize rapid data collection to inform immediate public health needs, assuming participants are aware of general research risks and will consent if the potential benefits are significant. Explanation. This scenario presents a professional challenge because it requires a public health researcher to balance the immediate need for data with the ethical imperative to protect vulnerable populations from potential harm. The researcher must navigate the complexities of risk assessment in a context where the potential benefits of research, improved public health interventions, must be weighed against the potential risks to participants, especially in a resource-limited setting like Ethiopia. Careful judgment is required to ensure that the research design is both scientifically sound and ethically defensible, adhering to the principles of beneficence, non-maleficence, and justice. The correct approach involves a comprehensive and iterative risk assessment process that prioritizes participant safety and well-being. This entails identifying potential risks, e.g., stigma, discrimination, psychological distress, breach of confidentiality, evaluating their likelihood and severity, and implementing robust mitigation strategies. This aligns with the ethical guidelines for public health research, which emphasize the need for informed consent, confidentiality, and the protection of vulnerable groups. Specifically, within the Ethiopian regulatory framework for health research, which is guided by principles of respect for persons, beneficence, and justice, a thorough risk assessment is a prerequisite for ethical approval by the Institutional Review Board (IRB). This process ensures that research protocols are designed to minimize harm and maximize potential benefits to society, with particular attention to the context and cultural sensitivities of the study population. An incorrect approach that focuses solely on the speed of data collection without adequately assessing or mitigating risks would be ethically and regulatorily unacceptable. This failure to conduct a thorough risk assessment violates the principle of non-maleficence, as it potentially exposes participants to harm without sufficient safeguards. Another incorrect approach that neglects to consider the specific vulnerabilities of the target population, e.g., individuals with a stigmatized condition, and fails to implement culturally appropriate communication strategies for informed consent would also be a significant ethical and regulatory failure. This overlooks the principle of justice, which requires fair distribution of research burdens and benefits, and the principle of respect for persons, which mandates that individuals be treated with dignity and autonomy, especially when they belong to groups that may be susceptible to coercion or exploitation. The professional decision-making process for similar situations should involve a systematic approach. 1. Clearly define the research objectives and the target population. 2. Conduct a comprehensive identification of all potential risks to participants, considering physical, psychological, social, and economic harms. 3. Evaluate the likelihood and severity of each identified risk. 4. Develop specific, practical, and culturally appropriate mitigation strategies for each risk. 5. Ensure that informed consent procedures are robust, transparent, and address all potential risks and benefits. 6. Consult with relevant ethical review boards and community stakeholders throughout the process. 7. Continuously monitor for adverse events and adapt mitigation strategies as needed. Question 7. Compliance review shows that preliminary data from a community survey in a peri-urban area of Addis Ababa suggests a potential increase in a specific non-communicable disease. However, the survey methodology had limitations, and the data has not yet undergone rigorous statistical validation or peer review. The Institute is under pressure from local community leaders to immediately implement widespread public health interventions. Which of the following represents the most appropriate immediate course of action for the Addis Continental Institute of Public Health? Option A. Immediately implement broad public health awareness campaigns and distribute informational materials about the suspected disease to the affected community based on the preliminary survey results. Option B. Initiate a comprehensive, evidence-based risk assessment process to validate the preliminary findings and determine the scope and severity of the potential public health issue before recommending any interventions. Option C. Advise community leaders that the preliminary data is insufficient and dismiss the findings without further investigation, focusing resources on known public health priorities. Option D. Publicly announce the potential increase in the disease and call for immediate community-wide screening programs to confirm the findings. The correct answer is B. Initiate a comprehensive, evidence-based risk assessment process to validate the preliminary findings and determine the scope and severity of the potential public health issue before recommending any interventions. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for public health intervention with the ethical and regulatory obligation to conduct a thorough and unbiased risk assessment. The Addis Continental Institute of Public Health, as an academic and research institution, must uphold rigorous standards in its research and recommendations. Prematurely acting on incomplete or potentially biased data could lead to misallocation of resources, ineffective interventions, and erosion of public trust. The core of the challenge lies in distinguishing between preliminary findings that warrant further investigation and definitive conclusions that can inform policy. The correct approach involves a systematic and evidence-based risk assessment process that prioritizes data integrity and scientific rigor. This entails clearly defining the scope of the risk, identifying potential hazards, collecting and analyzing relevant data from multiple sources, evaluating the likelihood and impact of the identified risks, and then formulating evidence-based recommendations. This approach aligns with the ethical principles of public health research, which demand accuracy, transparency, and a commitment to the well-being of the population based on sound scientific evidence. It also adheres to the implicit regulatory framework governing public health institutions, which expects decisions to be grounded in robust data and objective analysis to ensure public safety and effective resource allocation. An incorrect approach would be to immediately implement broad public health measures based solely on anecdotal evidence or preliminary, unverified data. This fails to meet the standards of a proper risk assessment by bypassing crucial steps of data validation and impact analysis. Such an approach risks creating unnecessary panic, diverting resources from more pressing issues, and potentially implementing interventions that are not only ineffective, but could also have unintended negative consequences. Ethically, it violates the principle of beneficence by not ensuring that interventions are truly beneficial and evidence-based. It also fails to uphold the principle of justice by potentially disproportionately affecting certain populations without sufficient justification. Another incorrect approach would be to dismiss the preliminary findings entirely without further investigation, especially if they suggest a potential public health threat. This demonstrates a failure to exercise due diligence and a lack of responsiveness to potential emerging risks. It neglects the precautionary principle, which suggests that in situations of uncertainty, where there is a plausible risk of harm, protective measures may be warranted even if scientific certainty is not yet established. This approach could lead to a delayed response, allowing a potential public health crisis to escalate. The professional decision-making process in such situation should involve a phased approach. First, acknowledge and document preliminary findings. Second, initiate a rapid but thorough risk assessment process to validate the data and understand the potential scope and severity of the risk. This includes consulting with relevant experts, reviewing existing literature, and planning for further data collection if necessary. Third, based on the evolving risk assessment, communicate findings transparently and develop proportionate, evidence-based recommendations for action, clearly outlining the level of certainty and the rationale behind them. Question 8. Regulatory review indicates that a new public health initiative aimed at controlling a rapidly spreading infectious disease in a densely populated urban area is being considered. The initiative involves a novel public health measure with limited but promising preliminary data on its efficacy, alongside potential side effects that are not fully characterized. What is the most appropriate approach to guide the decision-making process for implementing this initiative? Option A. Prioritize immediate implementation of the initiative based on the potential for significant public health benefits, assuming that any risks will be manageable and can be addressed post-implementation. Option B. Conduct a thorough risk assessment, systematically identifying potential harms and benefits, evaluating their likelihood and severity, and developing mitigation strategies before proceeding with implementation. Option C. Postpone any decision on the initiative until all possible risks are definitively quantified and understood, even if this means delaying a potentially life-saving intervention. Option D. Focus on public communication and engagement to build support for the initiative, deferring a detailed risk-benefit analysis until after public consensus is achieved. The correct answer is B. Conduct a thorough risk assessment, systematically identifying potential harms and benefits, evaluating their likelihood and severity, and developing mitigation strategies before proceeding with implementation. Explanation. This scenario presents a professional challenge due to the inherent uncertainty in public health interventions and the need to balance potential benefits against potential harms, especially when dealing with novel pathogens or limited data. The Addis Continental Institute of Public Health, operating within the Ethiopian regulatory framework for public health research and practice, must prioritize evidence-based decision-making and ethical considerations. The correct approach involves a comprehensive risk assessment that systematically identifies, analyzes, and evaluates potential risks associated with a proposed public health intervention. This includes considering the likelihood and severity of adverse outcomes, the affected populations, and the availability of mitigation strategies. This approach aligns with the ethical principles of beneficence and non-maleficence, as well as the regulatory requirement for evidence-based public health policy, ensuring that interventions are justified by their potential to improve health outcomes while minimizing harm. The Ethiopian Public Health Institute's guidelines, for instance, emphasize a data-driven and risk-informed approach to program design and implementation. An incorrect approach that focuses solely on the potential benefits without adequately considering the risks fails to uphold the principle of non-maleficence and may lead to unintended negative consequences for the population. This disregards the regulatory imperative to conduct thorough impact assessments. Another incorrect approach that prioritizes immediate public perception over scientific rigor or a balanced risk-benefit analysis can lead to poorly designed or ineffective interventions, potentially wasting resources and eroding public trust, which is contrary to ethical public health practice and national health policy objectives. Finally, an approach that delays action indefinitely due to an inability to quantify all risks perfectly, even when substantial evidence suggests a clear benefit and manageable risks, can lead to preventable morbidity and mortality, violating the duty to act in the public interest when reasonable certainty of benefit exists. Professionals should employ a structured decision-making process that begins with clearly defining the public health problem and the proposed intervention. This should be followed by a systematic risk assessment, incorporating available scientific evidence, expert opinion, and stakeholder input. The evaluation of potential benefits must be weighed against identified risks, with a clear rationale for the chosen course of action. Continuous monitoring and evaluation of the intervention's impact, including both intended and unintended consequences, are crucial for adaptive management and ensuring ongoing ethical and regulatory compliance. Question 9. Consider a scenario where a new, highly contagious respiratory virus emerges in a neighboring country, with initial reports suggesting a high potential for rapid international spread. The Addis Continental Institute of Public Health is tasked with developing an initial risk assessment to inform national preparedness strategies. Which of the following approaches best aligns with the principles of public health risk assessment within the Ethiopian regulatory framework for health emergencies? Option A. Focusing preparedness efforts exclusively on border control measures, assuming that preventing entry is the sole effective strategy, without considering the possibility of internal transmission or the need for broader public health interventions. Option B. Allocating resources to address the most widely discussed global health threats, regardless of their immediate proximity or specific relevance to Ethiopia, to ensure broad international alignment. Option C. Conducting a comprehensive risk assessment that includes evaluating the likelihood of introduction, the potential severity of illness, the capacity of the Ethiopian health system to detect and respond, and the potential socio-economic consequences, using available epidemiological data and expert opinion. Option D. Prioritizing preparedness efforts based on the perceived novelty and media attention surrounding the virus, without a detailed analysis of its transmissibility, severity, and potential impact on the Ethiopian population and healthcare system. The correct answer is D. Prioritizing preparedness efforts based on the perceived novelty and media attention surrounding the virus, without a detailed analysis of its transmissibility, severity, and potential impact on the Ethiopian population and healthcare system. Explanation. This scenario presents a professional challenge due to the inherent uncertainty and potential impact of emerging infectious diseases on public health infrastructure and community well-being. The Addis Continental Institute of Public Health, as a leading institution, is expected to demonstrate robust risk assessment capabilities, balancing proactive preparedness with resource allocation and ethical considerations. The core challenge lies in translating potential threats into actionable strategies that are both effective and justifiable within the Ethiopian public health context and its guiding regulations. The correct approach involves a systematic and evidence-based risk assessment process that prioritizes potential public health impacts, considers the likelihood of occurrence, and evaluates the capacity of existing systems to respond. This aligns with the principles of public health preparedness and emergency management, which are implicitly guided by national health policies and international best practices adopted by Ethiopia. Specifically, requires identifying credible threats, assessing their potential severity and spread, and then determining appropriate mitigation and response measures. This approach ensures that interventions are targeted, efficient, and ethically sound, minimizing harm and maximizing benefit to the population. An incorrect approach that focuses solely on the most sensational or widely publicized threats without a thorough assessment of local context and impact would be professionally unacceptable. This fails to adhere to the principle of evidence-based decision-making, potentially leading to misallocation of scarce resources and diverting attention from more immediate or probable risks relevant to Ethiopia. Another incorrect approach that neglects to consider the capacity of the Ethiopian health system to manage a particular risk would be equally flawed. This overlooks the practical realities of implementation and could result in unrealistic preparedness plans that are unachievable, thereby undermining public trust and safety. A third incorrect approach that prioritizes short-term political expediency over long-term public health security would be ethically reprehensible, as it compromises the fundamental duty of public health professionals to protect the population's well-being. Professionals should employ a decision-making framework that begins with defining the scope of the risk assessment, followed by hazard identification, vulnerability assessment, and consequence analysis. This should be integrated with an evaluation of existing control measures and the development of response strategies. Continuous monitoring and review are crucial to adapt to evolving threats and improve preparedness over time. This systematic process ensures that decisions are informed, defensible, and aligned with the overarching goal of safeguarding public health. Question 10. Strategic planning requires a robust framework for evaluating potential public health initiatives. Considering the mandate of the Addis Continental Institute of Public Health and the principles of evidence-based public health practice, which of the following approaches best guides the selection of projects for resource allocation? Option A. Selecting projects based on the personal experience and recommendations of senior faculty members, without formal evaluation. Option B. Conducting a comprehensive risk-benefit analysis for each proposed initiative, considering potential health outcomes, resource implications, and ethical considerations. Option C. Prioritizing initiatives based on the perceived severity and immediate public outcry surrounding a particular health issue. Option D. Allocating resources primarily to projects that have secured external funding, regardless of their alignment with strategic priorities or potential impact. The correct answer is B. Conducting a comprehensive risk-benefit analysis for each proposed initiative, considering potential health outcomes, resource implications, and ethical considerations. Explanation. This scenario presents a professional challenge due to the inherent uncertainty in public health initiatives and the need to allocate limited resources effectively. The Addis Continental Institute of Public Health, operating within the Ethiopian regulatory framework for public health research and implementation, must prioritize projects that demonstrate the greatest potential impact while adhering to ethical guidelines and evidence-based practices. The challenge lies in balancing the urgency of identified health needs with the feasibility and potential effectiveness of proposed interventions, all within a context that demands accountability to stakeholders and the public. The correct approach involves a systematic and evidence-based risk assessment that quantifies potential benefits against potential harms and resource requirements. This approach aligns with the principles of public health ethics and the operational guidelines for health program development in Ethiopia, which emphasize data-driven decision-making, stakeholder engagement, and a commitment to maximizing public good. By identifying and evaluating potential risks and benefits, the Institute can make informed strategic choices that are both responsible and impactful. An approach that prioritizes projects based solely on the perceived urgency of a health issue without a thorough risk assessment is ethically flawed. It risks misallocating resources to interventions that may be ineffective or even harmful, failing to meet the Institute's mandate of improving public health outcomes. Similarly, an approach that focuses exclusively on the availability of funding without considering the potential impact or risks associated with a project neglects the core principles of responsible resource management and public health stewardship. Finally, an approach that relies on anecdotal evidence or personal opinions, rather than systematic data and expert consensus, undermines the scientific integrity of the strategic planning process and is contrary to the evidence-based practice expected within the public health sector. Professionals in this field should employ a decision-making framework that begins with clearly defining the strategic objectives. This is followed by a comprehensive identification of potential risks and benefits associated with each strategic option, utilizing available data and expert consultation. The next step involves evaluating these risks and benefits against established public health criteria and ethical considerations. Finally, a transparent and justifiable decision is made, with mechanisms for ongoing monitoring and evaluation to adapt the strategy as new information emerges. Question 11. The investigation demonstrates that a participant in a community health study at the Addis Continental Institute of Public Health has presented with symptoms highly suggestive of a novel infectious disease with a rapid transmission rate, posing a significant risk to the wider community. The participant has expressed strong reservations about disclosing their health status due to personal privacy concerns. Which of the following represents the most ethically and legally sound approach for the Institute to manage this situation? Option A. Respect the participant's privacy concerns fully and refrain from reporting the suspected infectious disease, advising the participant to self-isolate and seek medical attention without further intervention from the Institute. Option B. Conduct a preliminary risk assessment based on the limited information available, and, if the risk appears moderate, inform the participant's close contacts directly about the potential exposure without involving public health authorities. Option C. Immediately report the suspected infectious disease to the relevant public health authorities, prioritizing the protection of the wider community over the individual's immediate privacy concerns, while initiating a formal risk assessment to determine necessary follow-up actions. Option D. Delay any action until the participant provides explicit written consent for the disclosure of their health information, even if this significantly increases the risk of community transmission. The correct answer is C. Immediately report the suspected infectious disease to the relevant public health authorities, prioritizing the protection of the wider community over the individual's immediate privacy concerns, while initiating a formal risk assessment to determine necessary follow-up actions. Explanation. This scenario presents a professional challenge due to the inherent conflict between the need to protect public health and the ethical obligation to maintain patient confidentiality. The Addis Continental Institute of Public Health, operating within the Ethiopian regulatory framework for public health research and practice, must navigate these competing interests with utmost care. The challenge lies in identifying and reporting potential public health threats without violating individual privacy rights, which are protected under Ethiopian law and ethical guidelines for health professionals. The correct approach involves a systematic risk assessment that prioritizes public health while adhering to legal and ethical mandates for confidentiality. This approach requires a thorough evaluation of the severity and imminence of the public health risk, the potential for harm to the wider community, and the availability of less intrusive measures. It necessitates consultation with relevant authorities and adherence to established protocols for reporting and intervention, ensuring that any disclosure of information is strictly limited to what is necessary to mitigate the risk and is done through appropriate channels. This aligns with the ethical principles of beneficence, acting in the best interest of the public, and non-maleficence, avoiding harm, balanced against respect for autonomy and privacy. An incorrect approach would be to immediately disclose the individual's health status to unauthorized parties without a formal risk assessment. This would constitute a breach of confidentiality, violating ethical codes and potentially Ethiopian data protection laws, leading to legal repercussions and erosion of trust in public health institutions. Another incorrect approach would be to ignore the potential public health risk due to an overemphasis on individual confidentiality, thereby failing in the duty to protect the broader community, which is a core mandate of public health. A third incorrect approach would be to conduct a superficial risk assessment that does not adequately consider the severity or likelihood of transmission, leading to either unnecessary alarm or insufficient protective measures. Professionals should employ a decision-making framework that begins with identifying the potential public health risk. This is followed by a comprehensive risk assessment, considering factors such as the nature of the disease, mode of transmission, susceptibility of the population, and potential impact. This assessment should inform the decision on whether and how to proceed, always seeking the least intrusive means to achieve the public health objective. Consultation with supervisors, legal counsel, and public health authorities is crucial at each stage to ensure compliance with regulations and ethical standards. Question 12. The analysis reveals that a vital community health initiative aimed at improving maternal and child nutrition in a peri-urban area is experiencing challenges due to increasingly unpredictable rainfall patterns, impacting the availability of locally sourced fresh produce. This situation necessitates a review of the program's operational framework to ensure continued effectiveness and safety. Which of the following approaches best addresses this emerging challenge? Option A. Focus solely on educational outreach regarding nutrition, downplaying the logistical challenges posed by the environmental changes. Option B. Immediately seek alternative, potentially more expensive imported food supplies without evaluating the long-term sustainability or nutritional suitability of these alternatives. Option C. Continue with the current program delivery model, assuming that the community will adapt to the changing produce availability. Option D. Conduct a comprehensive risk assessment to identify potential impacts of environmental changes on food security, program delivery, and community health, and develop adaptive strategies. The correct answer is D. Conduct a comprehensive risk assessment to identify potential impacts of environmental changes on food security, program delivery, and community health, and develop adaptive strategies. Explanation. The analysis reveals a scenario where a public health program, crucial for community well-being, faces potential disruption due to unforeseen environmental changes. This presents a professionally challenging situation because it requires balancing the immediate needs of the program with long-term sustainability and the safety of the target population. Careful judgment is required to identify and mitigate risks without compromising the program's objectives or public trust. The correct approach involves a proactive and systematic risk assessment process. This entails identifying potential hazards, e.g., water contamination, disease vector changes, analyzing their likelihood and impact, and developing appropriate control measures. This aligns with the ethical principles of beneficence, acting in the best interest of the community, and non-maleficence, avoiding harm. Furthermore, it adheres to the general principles of good public health practice, which emphasize evidence-based decision-making and preparedness for emergent threats. While specific regulations for the Addis Continental Institute of Public Health entrance exam are not provided, the core principles of risk management are universally applicable in public health and are implicitly expected in any rigorous academic or professional setting. An approach that focuses solely on immediate program delivery without considering the environmental context is professionally unacceptable. This failure to conduct a comprehensive risk assessment neglects the potential for harm to the beneficiaries and the program's long-term viability. It demonstrates a lack of foresight and a disregard for the interconnectedness of public health initiatives with their surrounding environment. Another incorrect approach would be to dismiss potential risks as unlikely without rigorous investigation. This is a failure of due diligence and can lead to catastrophic consequences if the risks materialize. It violates the principle of prudence and the responsibility to anticipate and prepare for foreseeable problems. Finally, an approach that prioritizes cost-cutting over risk mitigation, even when significant risks are identified, is ethically and professionally unsound. Public health programs have a primary responsibility to protect and improve community health, and this responsibility must not be compromised by financial considerations alone. Professionals should employ a structured decision-making framework that begins with a thorough understanding of the program's objectives and context. This should be followed by a systematic risk identification and analysis process, considering all potential internal and external factors. Control measures should be developed based on the assessed risks, prioritizing those that offer the greatest protection with reasonable feasibility. Continuous monitoring and evaluation of risks and control measures are essential for adaptive management. Question 13. Cost-benefit analysis shows that a proposed new vaccination program for a prevalent childhood disease in Ethiopia has a high potential for long-term health gains, but also carries a significant upfront financial cost and a small but non-zero risk of severe adverse events. Given the limited but growing body of evidence on the vaccine's efficacy and safety in similar contexts, which risk assessment approach best aligns with the principles of public health ethics and responsible resource allocation within the Ethiopian context for the Addis Continental Institute of Public Health? Option A. focus primarily on minimizing the immediate financial expenditure by selecting the least expensive vaccine option, even if its long-term efficacy is less certain. Option B. Prioritize a comprehensive risk assessment that includes evaluating potential public health benefits against all identified risks, including those with low probability but high impact, and recommends a phased implementation with robust monitoring. Option C. Delay the decision until extensive, long-term epidemiological studies are completed in Ethiopia, even if this means foregoing immediate public health benefits. Option D. Rely on anecdotal reports from healthcare providers about vaccine side effects to determine the acceptable level of risk, without formal statistical analysis. The correct answer is B. Prioritize a comprehensive risk assessment that includes evaluating potential public health benefits against all identified risks, including those with low probability but high impact, and recommends a phased implementation with robust monitoring. Explanation. This scenario presents a professional challenge because it requires balancing the potential benefits of a public health intervention against its associated costs and risks, all within the specific regulatory and ethical landscape of Ethiopia, as governed by the Addis Continental Institute of Public Health's entrance exam framework. The challenge lies in identifying the most appropriate risk assessment approach when faced with incomplete data and potential public health impacts. The correct approach involves a comprehensive risk assessment that prioritizes public health and safety, even with limited data. This aligns with the ethical imperative in public health to act in the best interest of the population and adhere to principles of precaution. Regulatory frameworks, even if not explicitly detailed in the exam scope, generally mandate a thorough evaluation of potential harms and benefits before implementing interventions. This approach ensures that decisions are evidence-informed, transparent, and accountable, minimizing the likelihood of unintended negative consequences. An incorrect approach would be to solely focus on the immediate financial costs and quantifiable benefits, ignoring potential long-term or less tangible public health risks. This fails to meet the ethical obligation to protect vulnerable populations and could lead to decisions that are detrimental to public well-being. Another incorrect approach would be to delay action indefinitely due to data limitations, which contradicts the principle of timely intervention in public health emergencies or when significant risks are identified. This inaction can exacerbate public health problems. A third incorrect approach might involve relying on anecdotal evidence or stakeholder opinions without rigorous scientific validation, which undermines the evidence-based nature of public health practice and can lead to misallocation of resources or ineffective interventions. Professionals should employ a decision-making framework that begins with clearly defining the public health problem and the potential intervention. This is followed by a systematic identification and evaluation of risks and benefits, considering both quantitative and qualitative factors. Crucially, the framework must incorporate a process for addressing uncertainty and data gaps, often through a precautionary principle or by seeking further evidence where feasible. Transparency and stakeholder engagement are also vital components, ensuring that decisions are understood and accepted by the community. Question 14. To address the challenge of conducting a public health intervention study in a rural Ethiopian community with limited prior research experience, which risk assessment approach best aligns with ethical principles and the regulatory framework for public health research in Ethiopia, ensuring both scientific rigor and community well-being? Option A. A participatory risk assessment involving community leaders, local health workers, and community members to identify and mitigate potential harms, alongside technical expert evaluation. Option B. A rapid risk assessment prioritizing speed of implementation to gather data quickly with post-intervention risk management. Option C. A risk assessment focused exclusively on immediate biological and epidemiological risks with minimal community consultation to expedite data collection. Option D. A risk assessment conducted solely by an external panel of technical public health experts based on established international guidelines. The correct answer is A. A participatory risk assessment involving community leaders, local health workers, and community members to identify and mitigate potential harms, alongside technical expert evaluation. Explanation. The scenario presents a common challenge in public health research. balancing the need for robust data collection with the ethical imperative to protect vulnerable populations and ensure community engagement. The Addis Continental Institute of Public Health, operating within the Ethiopian regulatory framework for research and public health initiatives, must prioritize approaches that are both scientifically sound and ethically responsible. The challenge lies in identifying the most appropriate risk assessment strategy that aligns with these principles and the specific context of the community being studied. The correct approach involves a comprehensive, participatory risk assessment that actively involves community stakeholders. This method is crucial because it acknowledges that risks are not solely technical or scientific, but also social, cultural, and ethical. By engaging the community, researchers can identify potential harms that might be overlooked by external experts, such as stigma, unintended consequences of data disclosure, or disruption of community norms. This aligns with ethical principles of respect for persons, beneficence, and justice, and is often mandated by national research ethics guidelines that emphasize community consultation and informed consent at collective level where appropriate. It fosters trust and ensures that the research benefits the community, not just the researchers. An approach that relies solely on an expert panel's technical assessment of risks is flawed because it lacks community perspective. This can lead to an underestimation of social and cultural risks, potentially causing harm to the community and eroding trust in public health initiatives. It fails to uphold the principle of beneficence by not adequately considering the well-being of the community as a whole. Another incorrect approach, focusing only on immediate health risks without considering broader socioeconomic or cultural impacts, is also insufficient. Public health interventions can have ripple effects, and a narrow focus can miss significant risks such as economic disruption, increased social stratification, or unintended negative health consequences stemming from altered behaviors or resource allocation. This approach neglects the holistic nature of public health and the interconnectedness of various risk factors. Finally, an approach that prioritizes speed of data collection over thorough risk assessment is ethically unacceptable. In public health research, particularly in contexts where communities may have historical reasons for mistrust or are particularly vulnerable, rushing the process can lead to exploitation or harm. The ethical obligation to protect participants and the community from harm must always take precedence over expediency. The professional decision-making process for similar situations should involve a multi-stakeholder consultation from the outset. This includes engaging community leaders, local health officials, and ethics review boards. A phased risk assessment, starting with broad community engagement to identify potential concerns, followed by expert technical assessment, and then a joint review and mitigation planning, is a robust framework. Continuous monitoring and feedback mechanisms are also essential throughout the research lifecycle. Question 15. The review process indicates that the Addis Continental Institute of Public Health needs to enhance its preparedness for potential public health emergencies. Considering the Institute's mandate and limited resources, which approach to risk assessment would best ensure effective allocation of preparedness efforts? Option A. Prioritizing preparedness activities based on the perceived urgency of immediate, visible public health concerns, even if their long-term impact is less severe. Option B. Engaging in broad stakeholder consultations to gather opinions on potential risks without establishing a systematic methodology for analyzing and prioritizing these risks. Option C. Focusing preparedness efforts solely on infectious diseases that have historically caused significant outbreaks within the region. Option D. Conducting a comprehensive risk assessment that identifies potential public health threats, analyzes their likelihood and impact, and prioritizes mitigation strategies based on a structured evaluation framework. The correct answer is D. Conducting a comprehensive risk assessment that identifies potential public health threats, analyzes their likelihood and impact, and prioritizes mitigation strategies based on a structured evaluation framework. Explanation. The review process indicates a potential gap in the Addis Continental Institute of Public Health's preparedness for emerging infectious diseases. This scenario is professionally challenging because it requires a proactive and systematic approach to risk assessment in a public health context, where the consequences of inaction can be severe and widespread. The Institute must balance resource allocation with the need for robust preparedness, considering both the likelihood and impact of various threats. The correct approach involves a comprehensive risk assessment that systematically identifies potential public health threats, analyzes their likelihood and potential impact on the institute's operations and the wider community, and prioritizes mitigation strategies. This aligns with the ethical imperative of public health institutions to protect populations and the regulatory expectation for preparedness planning. Specifically, it reflects a commitment to evidence-based decision-making and the responsible stewardship of public health resources. An approach that focuses solely on historical data without considering novel or emerging threats would be an ethical and regulatory failure. Public health risks are dynamic, and relying only on past events can lead to a false sense of security and inadequate preparation for future challenges. Similarly, an approach that prioritizes immediate, visible threats over potentially more devastating, but less probable ones, neglects the principle of comprehensive risk management. It fails to acknowledge that preparedness must encompass a spectrum of risks, not just those that have recently occurred. An approach that involves extensive consultation, but lacks a structured methodology for evaluating and prioritizing risks would also be deficient. While stakeholder input is valuable, without a systematic framework, the assessment can become subjective and fail to identify the most critical vulnerabilities. Professionals should employ a decision-making framework that begins with a clear definition of the scope of the risk assessment. This should be followed by systematic hazard identification, analysis of likelihood and impact, evaluation of existing controls, and development of prioritized mitigation and response plans. Regular review and updating of the assessment are crucial to adapt to evolving threats and institutional capacities. Question 16. What factors determine the most appropriate approach to assessing and managing a novel infectious disease outbreak in a rural Ethiopian community, considering both rapid intervention needs and community engagement principles? Option A. The immediate availability of diagnostic tools and the potential for international collaboration in resource mobilization. Option B. Speed of data collection and the availability of external expert opinions for immediate decision-making. Option C. The reliance on pre-existing national health protocols without specific local adaptation and the perceived urgency of the situation. Option D. The extent of community participation in risk assessment and intervention planning, alongside culturally appropriate communication strategies. The correct answer is D. The extent of community participation in risk assessment and intervention planning, alongside culturally appropriate communication strategies. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for public health intervention with the ethical imperative of informed consent and community engagement. Public health professionals at the Addis Continental Institute of Public Health must navigate complex situations where rapid response is crucial, but without alienating or disregarding the affected population's autonomy and cultural context. Careful judgment is required to ensure interventions are both effective and ethically sound, respecting local customs and ensuring long-term sustainability. The correct approach involves a comprehensive risk assessment that prioritizes community engagement and culturally sensitive communication. This approach is right because it aligns with ethical principles of public health practice, emphasizing respect for persons, beneficence, and justice. Specifically, it acknowledges that effective public health interventions are most successful when they are developed and implemented in partnership with the communities they serve. This fosters trust, increases adherence to interventions, and ensures that solutions are contextually appropriate and sustainable. Regulatory frameworks and ethical guidelines for public health in Ethiopia, as in many jurisdictions, mandate community consultation and informed consent, especially when interventions might impact daily life or require behavioral changes. An approach that focuses solely on rapid data collection without immediate community consultation fails to acknowledge the importance of building trust and obtaining buy-in. This can lead to resistance, misinformation, and ultimately, the failure of the intervention, violating the principle of beneficence by not ensuring the greatest good for the greatest number in the long term. An approach that relies on external expert opinions without significant local input overlooks the invaluable knowledge and perspectives of the affected community. This can result in interventions that are impractical, culturally inappropriate, or even harmful, demonstrating a failure in justice and respect for persons. An approach that prioritizes immediate resource allocation based on preliminary assumptions, without a thorough understanding of community dynamics and potential risks misallocation of resources, and may overlook critical social determinants of health, that are best understood by the community itself. This can lead to ineffective interventions and a failure to address the root causes of the public health issue. Professionals should employ a decision-making framework that begins with understanding the context, identifying stakeholders, including the community, assessing potential risks and benefits from multiple perspectives, and then developing a culturally appropriate and ethically sound intervention plan. This iterative process involves continuous communication and adaptation based on community feedback and evolving risk factors. Question 17. Benchmark analysis indicates that a new public health initiative aimed at improving maternal and child health outcomes in a specific region requires extensive data collection from diverse community settings. The research team is eager to commence data collection to inform policy decisions rapidly. Which of the following approaches best aligns with the ethical and regulatory requirements for conducting such research at the Addis Continental Institute of Public Health? Option A. Rely on the personal experience and judgment of senior researchers to anticipate and manage any unforeseen issues that may arise during data collection. Option B. Proceed with data collection using existing, readily available data sources without a formal assessment of their suitability or potential biases to expedite the research process. Option C. Conduct a comprehensive risk assessment that systematically identifies potential ethical, privacy, and operational risks, evaluates their likelihood and impact, and outlines specific mitigation strategies before initiating data collection. Option D. Prioritize rapid data collection to inform policy decisions quickly, assuming that the potential benefits of the initiative outweigh any minor risks that might arise. The correct answer is C. Conduct a comprehensive risk assessment that systematically identifies potential ethical, privacy, and operational risks, evaluates their likelihood and impact, and outlines specific mitigation strategies before initiating data collection. Explanation. This scenario presents a professional challenge in public health research due to the inherent ethical considerations and the need to adhere to established research protocols. The Addis Continental Institute of Public Health, like any reputable institution, operates under strict ethical guidelines and regulatory frameworks governing research involving human participants and the responsible use of data. The challenge lies in balancing the pursuit of valuable public health insights with the imperative to protect participant privacy and ensure data integrity. Careful judgment is required to select an approach that is both scientifically sound and ethically compliant. The correct approach involves a systematic and documented process of identifying potential risks associated with the proposed research, evaluating their likelihood and impact, and then developing and implementing appropriate mitigation strategies. This aligns with the principles of ethical research conduct, which mandate a proactive and responsible approach to risk management. Specifically, it reflects the ethical obligation to minimize harm to participants and to ensure the integrity and validity of research findings. Regulatory frameworks governing research ethics, such as those likely adopted by the Addis Continental Institute of Public Health, emphasize the importance of a comprehensive risk assessment as a prerequisite for obtaining ethical approval and conducting research. This process ensures that potential harms are anticipated and addressed before they materialize, thereby safeguarding the well-being of participants and the reputation of the research institution. An incorrect approach that focuses solely on the potential benefits without a thorough assessment of risks fails to uphold the ethical principle of non-maleficence, do no harm. It overlooks the responsibility to protect vulnerable populations and to prevent potential breaches of confidentiality or data misuse. Another incorrect approach that prioritizes speed and efficiency over a rigorous risk assessment can lead to overlooking critical vulnerabilities, potentially resulting in significant ethical breaches and reputational damage. This disregards the established ethical standards that require due diligence in research planning. Furthermore, an approach that relies on anecdotal evidence or assumptions rather than a structured, evidence-based risk assessment is professionally unsound. It lacks the objectivity and rigor necessary to ensure ethical research practices and may lead to unforeseen negative consequences. Professionals should employ a decision-making framework that begins with a clear understanding of the research objectives and the context. This should be followed by a systematic identification of all potential risks, considering factors such as participant vulnerability, data sensitivity, and methodological limitations. Each identified risk should then be evaluated for its likelihood and potential impact. Based on this evaluation, appropriate control measures and mitigation strategies should be developed and documented. This structured approach ensures that all ethical and regulatory requirements are met, and that the research is conducted in a responsible and scientifically rigorous manner. Question 18. Market research demonstrates a significant increase in the prevalence of a specific non-communicable disease within a peri-urban community in Ethiopia. The Addis Continental Institute of Public Health is planning a study to understand the contributing factors and develop targeted interventions. Which of the following approaches to assessing the risks associated with this research study best aligns with the ethical and regulatory framework for public health research in Ethiopia? Option A. Relying solely on existing epidemiological data and published literature from similar contexts to anticipate potential risks, without direct engagement with the target community or local health authorities for current risk assessment. Option B. Outlining potential risks based on general public health research guidelines and delegating the final approval of the risk assessment to an external consultancy firm specializing in research ethics, with minimal internal review or community consultation. Option C. Conducting a thorough risk assessment that involves community leaders, local health officials, and the Institutional Ethics Review Board to identify potential harms, assess their likelihood and impact, and develop mitigation strategies, with a strong emphasis on data privacy and informed consent. Option D. Prioritizing the statistical rigor of the study design and ensuring that data collection methods are efficient for generating statistically significant findings, assuming that any risks to the community will be minimal and manageable through standard research protocols. The correct answer is C. Conducting a thorough risk assessment that involves community leaders, local health officials, and the Institutional Ethics Review Board to identify potential harms, assess their likelihood and impact, and develop mitigation strategies, with a strong emphasis on data privacy and informed consent. Explanation. This scenario presents a professional challenge because it requires balancing the ethical imperative to protect vulnerable populations with the practical need to gather essential data for public health interventions. The Addis Continental Institute of Public Health, operating within the Ethiopian regulatory framework for public health research and data collection, must ensure that any risk assessment is robust and considers the potential for unintended negative consequences on the target community. The challenge lies in identifying and mitigating risks without compromising the integrity or feasibility of the research. The correct approach involves a comprehensive, multi-stakeholder risk assessment that prioritizes community engagement and ethical review. This approach is right because it aligns with the principles of ethical research conduct, which are enshrined in national public health guidelines and international ethical standards adopted by Ethiopian institutions. Specifically, it emphasizes obtaining informed consent, ensuring data privacy, and actively involving community representatives in the risk identification and mitigation process. This proactive and inclusive method minimizes potential harm and builds trust, which is crucial for the success of public health initiatives. An approach that focuses solely on statistical validity without considering community impact is ethically flawed. It fails to acknowledge the potential for research activities to exacerbate existing inequalities or create new vulnerabilities within the community, a direct violation of ethical research principles that mandate the protection of human subjects. An approach that relies on historical data alone, without current community consultation, is also problematic. Public health contexts are dynamic, and past risks may not accurately reflect present dangers or community concerns. This can lead to an incomplete or outdated risk assessment, potentially overlooking emerging threats or failing to address current community sensitivities. An approach that delegates the entire risk assessment to external consultants without internal ethical oversight or community input is insufficient. While external expertise can be valuable, the primary responsibility for ethical conduct and community well-being rests with the institution and its researchers. Without internal ethical review and community engagement, the assessment may lack the nuanced understanding of local context and ethical considerations required. The professional decision-making process for similar situations should involve a structured risk assessment framework that includes 1. Hazard identification, identifying potential risks to the community and researchers. 2. Risk analysis, Evaluating the likelihood and impact of identified hazards. 3. Risk evaluation, determining the acceptability of risks. 4. Risk treatment, developing and implementing strategies to mitigate unacceptable risks. 5. Monitoring and review, continuously assessing the effectiveness of mitigation strategies and updating the risk assessment as needed. Crucially, this process must be iterative and involve continuous dialogue with community stakeholders and the Institutional Ethics Review Board. Question 19. The risk matrix shows a high likelihood of significant public health impact from an emerging infectious disease outbreak in a remote region of Ethiopia. Researchers have collected preliminary data on symptomology and transmission patterns, which they believe could inform immediate public health responses. However, due to the urgency and logistical challenges, obtaining individual informed consent for the use of this preliminary data in immediate reports and potential publications has not been fully completed for all participants. The researchers are considering releasing the anonymized data to accelerate the public health response. Which of the following approaches best aligns with the ethical and regulatory framework for public health research in Ethiopia? Option A. Share the anonymized data with international public health organizations for their analysis and dissemination, assuming their ethical standards are sufficient. Option B. Submit the preliminary findings and proposed data use plan to the relevant Ethiopian Institutional Review Board, (ERB), for expedited review, seeking guidance on appropriate consent procedures and data anonymization protocols before any dissemination. Option C. Proceed with releasing the anonymized data immediately to inform the public health response, as the potential benefit to the wider population outweighs the minor risk of incomplete consent for anonymized data. Option D. Halt all data dissemination and publication until individual informed consent is obtained from every participant, even if it delays critical public health interventions. The correct answer is C. Proceed with releasing the anonymized data immediately to inform the public health response, as the potential benefit to the wider population outweighs the minor risk of incomplete consent for anonymized data. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for public health intervention with the ethical imperative of informed consent and data privacy, all within the specific regulatory context of Ethiopia's public health data management and research ethics. The Addis Continental Institute of Public Health, as an academic and research institution, must adhere to national laws and ethical guidelines that govern the collection, use, and dissemination of health information, particularly when dealing with sensitive data from vulnerable populations. The risk matrix, while a useful tool for identifying potential issues, does not dictate the ethical or legal course of action. It merely highlights areas requiring careful consideration and mitigation strategies. The correct approach involves a thorough ethical review process that prioritizes obtaining informed consent from participants, even in emergency situations, and ensuring robust data anonymization and security measures are in place before any data is shared or published. This aligns with Ethiopia's National Health Research Ethics Guidelines, which emphasize the protection of human subjects, the principle of beneficence, and the right to privacy. Specifically, the process would involve seeking approval from an Institutional Review Board (ERB) or equivalent ethics committee, which would assess the proposed data use against ethical principles and legal requirements. The IRB would guide the researchers on how to best obtain consent, even if it requires innovative methods in an emergency, and ensure that data is de-identified to prevent re-identification of individuals, thereby upholding confidentiality and preventing potential harm. An incorrect approach that involves immediately publishing anonymized data without a formal ethical review or attempting to obtain consent retrospectively would be professionally unacceptable. This fails to uphold the fundamental ethical principle of respect for persons, which includes the right to autonomy and informed consent. While the data may be anonymized, the initial collection and subsequent use of that data without proper authorization or ethical oversight can still violate privacy rights and erode public trust in research institutions. Furthermore, bypassing ethical review processes can lead to the publication of flawed or biased research, which can have detrimental consequences for public health policy and practice. Another incorrect approach, such as relying solely on the risk matrix to justify immediate data release without considering the ethical and legal implications of data handling, demonstrates a superficial understanding of risk management. The matrix is a tool for identification, not a substitute for ethical deliberation and regulatory compliance. Professional decision-making process for similar situations should involve a structured approach. First, identify the ethical and legal obligations relevant to the specific context and jurisdiction. Second, consult with relevant ethical review bodies, e.g., ERB, to seek guidance and approval. Third, develop a comprehensive risk mitigation plan that addresses both technical and ethical concerns, including robust data security and privacy protocols. Fourth, prioritize participant welfare and rights throughout the research lifecycle, from data collection to dissemination. Finally, maintain transparency and accountability in all research activities. Question 20. Cost-benefit analysis shows that a proposed large-scale vaccination campaign against a prevalent infectious disease in Ethiopia has a projected positive net benefit, but also carries a small but non-negligible risk of severe adverse events in a specific subpopulation. Which approach best aligns with the principles of responsible public health practice and ethical decision-making within the Ethiopian context? Option A. Postpone the decision until further research can completely eliminate any possibility of adverse events, even if this significantly delays the potential public health gains. Option B. Proceed with the vaccination campaign as planned, focusing on maximizing the overall public health benefit and accepting the minimal risk as an unavoidable trade-off. Option C. Halt the vaccination campaign immediately due to the identified risk of severe adverse events, prioritizing the absolute safety of all individuals above potential population-level benefits. Option D. Conduct a detailed ethical and risk mitigation assessment to identify strategies for minimizing the risk to the specific subpopulation, potentially involving targeted communication, enhanced surveillance, and alternative prophylactic measures, before proceeding with a modified campaign. The correct answer is B. Proceed with the vaccination campaign as planned, focusing on maximizing the overall public health benefit and accepting the minimal risk as an unavoidable trade-off. Explanation. This scenario is professionally challenging because it requires balancing the potential benefits of a new public health intervention against its associated costs and risks, all within the specific regulatory and ethical landscape of Ethiopia, as governed by the Addis Continental Institute of Public Health's entrance exam framework. The core of the challenge lies in making a decision that is not only scientifically sound, but also ethically justifiable and compliant with national public health priorities and resource allocation principles. Careful judgment is required to avoid prioritizing cost savings over essential public health outcomes or overlooking potential unintended consequences. The correct approach involves a comprehensive risk assessment that integrates both quantitative and qualitative factors, aligning with the principles of evidence-based public health policy and ethical considerations for vulnerable populations. This approach prioritizes identifying, evaluating, and mitigating potential harms while maximizing benefits, ensuring that any intervention is both effective and equitable. Specifically, it requires a thorough understanding of the Ethiopian public health context, including existing health infrastructure, community needs, and the potential impact on different socio-economic groups. Ethical considerations, such as informed consent, equity in access, and the precautionary principle, are paramount. An incorrect approach that solely focuses on minimizing immediate financial expenditure, without adequately assessing the long-term health consequences, or the potential for exacerbating existing health disparities, would be ethically and regulatorily unsound. This failure stems from a disregard for the fundamental ethical obligation to protect public health and promote well-being, which often necessitates upfront investment. Another incorrect approach that prioritizes perceived public demand or political expediency over rigorous scientific evidence, and a thorough risk assessment would also be professionally unacceptable. This would violate the principle of evidence-based decision-making, which is a cornerstone of effective public health practice and is implicitly expected within the framework of a public health institute's entrance exam. Such an approach risks implementing ineffective or even harmful interventions, undermining public trust and misallocating scarce resources. The professional decision-making process for similar situations should involve a structured framework that begins with clearly defining the public health problem and the proposed intervention. This should be followed by a systematic identification of all potential risks and benefits, considering various stakeholder perspectives, and the broader socio-economic and environmental context. A critical step is the evaluation of the likelihood and impact of identified risks and the development of appropriate mitigation strategies. Finally, the decision should be made based on a holistic evaluation that weighs the potential benefits against the mitigated risks, ensuring alignment with ethical principles and relevant national public health policies and guidelines.